TM joint is another field where you will be needing the CBCT. You know that the TM joint actually is a term that describes a joint that has too many components. There is the mandible, there is the temporal bone, and of course there is the disc and the muscles of mastication. So you have a bony component and you have a soft tissue component. Unfortunately, CBCT fails to show the soft tissues, and this is an inherent criteria of the characteristic feature of the CBCT. So you would go for the CAT scanners. However, if you are interested only in the bony component of the TM joint complex, then CBCT is your imaging modality of choice. In cases of you have a pathology, or you suspect pathology within the soft tissue, the capsule, the capsular spaces, the muscles of mastication, then you have to go to either the CBCT with the high dose, or you can go for the magnetic resonance imaging, both of which give you the three-dimensional view. And however, the MRI, there is no invasive radiation, there is no ionizing radiation, so it is of course the best thing to do. But you have the CAT scanner, because CAT scanners, they have the ability to show soft and hard tissue, of course, on the expense of the exposure. However, in the CBCT machines, in the new machines, there are systems that would mimic or represent or transfer the movements of the mandible, so that you can trace them. You can see the variation, you can see the degree of opening, you can see the dislocation or translational movement of the TM joint. The new machines offer this possibility, but still they, again, all of them fail to show the soft tissue component. Of course, you better go for the small limited field of view, so that you only cover the TM joint of interest. When it comes to cancers, especially if you want to detect the bony involvement, not the soft tissue, then CBCT can or is indicated for the evaluation of bony invasion. However, they do not provide the satisfactory information of the oral carcinoma. Any soft tissue lesions are badly displaced in the CBCT, so again we have to go for either the MRI or the CAT scanners. But if you want to see the extension or the involvement of the bony components, whatever, then CBCT is of course indicated. And then here you are going to extend the area of the field of view, because you want to see the invasion or the involvement of the surrounding structures, bony structures, in the lesion. When it comes to doses, as you can see here, that this is a table that shows you the doses, ionizing radiation dosages, approximate. Of course, considering we've talked about this earlier, is that we are exposed to a natural background daily radiation that is estimated to be between 7 to 8 microsieverts. 7 to 8 microsieverts. We are all exposed to about this radiation. This amount, by the way, is equal to the dose given in a 1 periapical radiograph. See, the doses increases like 1 digital periapical, 6 to 8 depends. It's equal to a dose of almost 1 day of radiation. When it comes to CBCT, it differs according to the machines. Some machines offer low doses on the expense of radiation of the resolution. Of course, A very important point to consider is the field of view. The larger the field of view, the more is the exposure, and hence the more is the radiation effects. If you reduce your field of view, then you are going to limit the radiation doses to the least possible. So try always to keep the doses to the possible. However, just to have an idea, the minimum amount of radiation given by this machine is that is either for the maxilla or the mandible is equal to around 9 days of exposure, of background exposure. If you go to other machines like CBCT Aquitomo, limited field is 3 days. Kodak limit only the mandible, the posterior it's around 6 days. ICAT it's around 10 days, and so on. So it depends on the exposure parameters, that is the field of view, kilovoltage, milliampere in seconds. Of course, these are adjusted according to the age of the patient, build of the patients, and so on, and whether you're going to give a full exposure or a limited field of view. Regardless of the type of radiation you're going to give, radiation safety is very important, whether it is a small periapical radiograph or a large CT or cone beam CT machine. Shielding, that is lead, is very important. Shielding devices could be used to reduce the doses to the thyroid gland when it is close to the primary beam, provided that it doesn't affect the quality of the image. In other words, it doesn't affect or it doesn't mask or obscure the image of the structure that you want to see. Otherwise, there is no point in using the thyroid devices or the thyroid glands. Care is needed in positioning so that repeating the exposure is avoided. It means that before you start exposing your patient, you better position a patient properly. And there are some machines, by the way, they can give scout images just to aid or help you or tell you whether that you have positioned your patient properly or not. When it comes to the protection of the staff, it is essential that a qualified expert is consulted over the installation of the CBCT. You cannot just install a CBCT machine just like you do with an intraoral X-ray machines. These machines are very sensitive, they have a high dose of radiation, and they should be placed in a room that is minimum 3 meters by 3 meters in dimension. Okay? And the walls, all the walls up to the ceiling, they should be leaded. The CBCT equipment should be installed in a protected enclosure, and the whole of the enclosure designated as a controlled area. Controlled area, it means that the exposure in this area, nobody should enter into the examination room except for the patient and the radiographer. The rooms, it depends on where you work, but these are international standards, and the international standards necessitate that the walls, doors, windows of the exposure room should all be leaded, so that when you stand outside of the exposure room, there should be no radiation or leaking radiation whatsoever. There is a great deal of scattered radiation in these machines, so all efforts should be taken to keep the radiation within the room and reduce the amount of scattered radiation by using larger rooms. Of course, all machines should be tested, even when there is the commissionary testing. That is when first the X-ray machine is installed, and there is a detailed acceptance and commissioning tests when equipment is new, and it should be routinely tested. throughout the life of the machine, because these are machines, as we said, they are sensitive machine. Any degree of movement or maluse affects the image quality, and hence it will may increase the chances of scattered or leaking radiation. Testing should follow published recommendations. It should be done by a justified or certified radiation physicist, and medical physics experts should be involved, and they should give the proper report that approves that this machine is suitable to be used. Dosimetry, detailed information on the dose due to the scattered radiation should be obtained to inform decisions about the shielding requirements. So again, this is for the medical physicist expert to do. They usually put different TLDs inside the room and outside the room where the patients are present and where the persons who are not involved in the radiation also are present, and then they will measure the radiation. Based on these readings, they will decide where the room is placed and how much shielding is needed. Now, if there are records that would say that or would indicate that there is scattered radiation, then the staff should be wearing measuring devices so that they will be monitored. If there is an overexposure, they should be stopped during the or not allowed to use if there is an overdose of radiation. Of course, all those involved with the radiation, CBCT or else, should have received adequate training for radiation protection, and there should always, we always as humans tend to forget. So there is always continuing medical and dental education and training even after the qualification, particularly when a new CBCT machine is used. So the take-home message is, if you think you need to purchase a CBCT machine for your practice or your clinic, consider the following. 1. Do you have a room that measures at least 3 by 3 meters? Because this is the rule. The rule is that small rooms are not accepted. As I said earlier, there is an amount or a great degree of scattered radiation. Scattered radiation within the room is decreased by if the room is large. So the minimum accepted room size is 3 by 3 meters. Now, if you have this room, is this room leaded? It should be leaded, all the walls. 2 millimeter thick lead. It should be 2 meters high. This considered, of course, the doors, the walls, the hinges, the windows, everything. So, and this should be tested, by the way. It's not only leading the walls. There should be a report that proves that there is no leaking radiation from the room, so that everybody outside the room is safe. Now, do you treat trauma cases? If you do, then you will be needing a CBCT. Do you do maxillofacial surgeries? Because definitely you will be needing a CBCT machine in your practice. Do you do any orthognathic surgeries? Abu Gazers, advancement of the maxillary, these things. A CBCT is a must in your clinic. Do you place implants? If you place implants, in some cases, Now CBCT is becoming the imaging modality of choice. Of course, for the possibility, because it offers the cross-sectional view, and there are now the new software and the systems and the techniques that will help and aid in correct and exact, I would say, placement of the implants. Plus, of course, the possibility of 3D printing and so on. All these now emerging into the practice. Do you perform endodontic surgeries? Those complicated ones. Many endodontists feel they are satisfied with intraoral periopical examination, periopical radiographs. There is no need for a CBCT. Do you do periodontal surgeries? Again, if you feel that you're not satisfied with the periopical view, then go buy yourself a CBCT machine. Are you interested in doing TM joint diagnosis and surgeries? Again, CBCT is machine is a real need if you are doing TM joint diagnosis and or surgeries, and if you do, then you have to have an idea, you have to have a proof that you have attended a radiation safety course, and then you have always to, at least every 3 years by the rules, or 2 years I guess, you have to attend and give a proof that you have attended a continuing medical education regarding the radiation safety. These are the references that you will find helpful, I hope, in giving you an idea about the CBCT and whether or not you will need them in your practice. And I thank you very much for, and I hope this lecture was, or presentation I would say, was helpful in deciding or helping you in deciding about purchasing a CBCT. Thank you very much.